Joined by Dr. Bharat Pankhania from Bath in the UK. He's a senior clinical lecturer at the University of Exeter Medical School. Doctor, it's a pleasure to have you on the program once again. Now, looking at what's happening in China right now, has their zero COVID policy failed them?
It is failing, unfortunately, because this serial lockdowns in Shanghai, Beijing, and other major cities is not sustainable, and it is extremely harmful to the residents who have to stay in control measures for weeks and months on end. A better way forward would be to immunize with a better vaccine, and then they will be able to move forward.
Speaking of vaccines, they've been a key factor in bringing case numbers and deaths down drastically. And in the U.S., actually, they've started to vaccinate infants as young as 6 months old, which has been a quite controversial decision to make. And even though that decision has been put into effect, the vaccination rates of infants has been quite low. Why is that?
There's a lot of miscommunication and unnecessary fear, especially now that we have ready access to social media. The issues are as follows. We immunize, and we've always immunized for two reasons. One, to protect the self, and two, to protect the community. And both of them go together. So whilst children and young adults may be at low risk of severe illness were they to get infected, they nevertheless generate cases, and they can make other older people, vulnerable people extremely ill. And when we've got a lot of people getting infected and generating viruses, you can also give rise to variants, as we have noticed. So this is a global effort. We immunize, and we immunize to suppress infections. And when you are immunizing across all the age groups, you will eventually achieve the goal of reducing the number of people who are infected and infectious. Therefore, it is a good thing to do.
Let's talk a bit about the severity of COVID-19. Give us some insight into the state of the virus at the moment, because it seems like, a lot of people are putting it in the category with other viruses, given that technically the severity of COVID-19 has drastically dropped, looking at the case numbers and the death numbers across the world.
So we mustn't associate SARS-CoV-2 virus, the coronaviruses, with influenza. It is a lot worse than influenza. Having said that, what is helping is that we have now got effective vaccines. And this is where I really implore China to use the Moderna, AstraZeneca, Pfizer brands of vaccines, which have been shown to work, compared to their own brand, which is working but not as well. So in terms of how nasty piece of work is SARS-CoV-2, it is still a danger. And the reason why we are not seeing severely ill people is because of two things. One, they've either been immunized, or two, they've got immunity by infection. And both of those things are protecting the people and reducing those large number of deaths that we had at the beginning of the pandemic.
All right, Dr. Bharat Pankhania, thank you so much for joining us here on TRT World. It's always a pleasure speaking to you.